Video lecture chapter 11, film mounting and viewing. Purpose: to present the basic concepts of film mounting and film viewing, to describe the step-by-step procedures that must be followed to prepare for the interpretation of radiographs. Basic concepts: mount: to place an appropriate setting as for display or study. In dental radiography, film mounting is the placement of radiographs in a supporting structure or holder. A film mount may be cardboard, plastic, or vinyl. It's used to support and arrange dental images in anatomic order. May be opaque or clear. Is available in many sizes and configurations. As a trained dental professional who possesses knowledge of normal anatomical landmarks of the maxilla, mandible, and related structures, we will be qualified to mount films. Usually, mounting film is the responsibility of the office dental radiographer. When and where are films mounted? They should be mounted immediately after processing, and this is going to require a clean, dry, light-colored work surface in front of an illuminator or a view box. Why would we use a film mount? It's quicker and easier to view and interpret. This is easily stored and available for interpretation. Decreases the chances of error in determining the patient's right and left side, and decreases handling of individual films and prevents damage to emulsion. Masks illumination adjacent to individual radiographs. What information are we going to place on the film mount? Well, we want the patient's full name, the date that the x-rays were exposed, the dentist's name, and then our name as the radiographer. Are mounts used with digital imaging? Most digital imaging systems allow the dental radiographer to choose the appropriate size mount. The mount should be labeled with the patient's full name and date of exposure. Normal anatomy and film mounting. Identification of landmarks helps distinguish maxillary periapical film from the mandibular periapical film. It's important to note the curve of SPI when mounting the bite wing radiographs. An identification dot is located in one corner of each intraoral film packet. This is going to be a small raised bump. All dots must face the same direction when mounted. Film is positioned in the packet such that the raised side of the dot faces the X-ray beam during exposure, used to determine film orientation. In labial mounting, the radiographs are placed in the film mount with the raised or convex surface of the indication dot facing the viewer. In lingual mounting, the radiographs are placed in the film mount with the depressed or concave side of the identification dot facing the viewer. Step-by-step procedure. Put a clean, light-colored paper towel over the work surface in front of the view box. Turn on the view box, label and date the film mount, wash and dry your hands. Examine each radiograph, identify the dot, and place each film with the raised side dot facing up. Sort radiographs into 3 basic groups: bite wing, anterior periapicals, and posterior periapicals. Arrange the films on the work surface in anatomic order. Place each film in the mount and secure it, and then check the radiographs. Hints: to master normal anatomy of the maxilla, mandible, and adjacent structures. Do label the date and film mount before mounting. Do mount films immediately after processing. Mount radiographs in a designated area. Sort the radiographs before mounting. And recognize that most root curves toward the distal. Film viewing, basic concepts, step-by-step, helpful hints. Film viewing is the examination of dental radiographs. All members of the dental team may interpret radiographs. It is the responsibility of the dentist to establish a final or definite interpretation and diagnosis. What equipment is required for film viewing? Well, we'll need a light source or a view box. This should be large enough to accommodate a variety of mounted films, and the light should be uniform intensity and evenly diffused. And then some magnification, maybe a magnifying glass to help interpretation. When and where are films viewed? Should view radiographs immediately after mounting, and they're best viewed in a room with dim light. Step-by-step procedures. View films in sequential order. Examine films for unerupted, missing, or impacted teeth, dental caries in size and shape of pulp and cavities, bony changes, the level of alveolar bone and calculus, roots and periapical areas, and all areas not previously examined. Begin with the maxillary teeth on the patient's right side. Move horizontally across to the maxillary teeth on the patient's left, down to the mandibular teeth on the patient's left side, horizontally across to the mandibular teeth on the patient's right side, up to bite wing films, view bite wing on the left and then the right. Do use a view box, block out harsh light, view films immediately after mounting, use a definite order for film viewing, and record all radiographic findings in the patient record.